If you already struggle with anxiety, odds are your anxiety has increased after becoming pregnant, especially if you're pregnant after infertility or miscarriage. Today, we're going to go over all of the pregnancy-safe options for managing your mental health. Welcome back to Every Mom is Midwife. My name's Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 27 weeks pregnant with an IVF pregnancy. Today, in weird pregnancy symptoms, one of my cheeks has been really red and warm for hours for no apparent reason. Anyway, like many millennials, I have struggled with anxiety and depression basically my entire adult life. I had originally intended to cover both anxiety and depression in pregnancy in this video, but the video was getting way too long, so I'll talk about anxiety this week and then I'll make a video about managing depression in pregnancy next week. The anxiety that comes with being pregnant after infertility or a loss is particularly brutal. Especially in early pregnancy, it's really hard to live in limbo and wonder, is my baby okay? Is their heart beating? Am I going to have another loss? It's easy for all of those fears to snowball and become completely overwhelming. What becomes more challenging is if you need medication to support your mood, because a lot of medications prescribed for anxiety are not safe to take in pregnancy. A lot of herbal remedies are also not recommended due to lack of research. As usual, I'm going to start with the non-medication options before covering the pregnancy-safe prescription medications. There are a lot of alternative therapies you can use if you become pregnant and you're struggling with anxiety. In my experience, a lot of women are just not comfortable taking medication during pregnancy, especially mood medications. I think acupuncture is a great option. I used it a lot in my pregnancy with my daughter. Unfortunately, it's not always covered by insurance. The same goes for therapy. I personally have not found talk therapy very helpful, but I know a lot of my patients have. That being said, since COVID, mental health resources are spread very thin, and there can be a very long wait to get in to see a therapist, if you can even get one to call you back at all. Again, this is usually not covered by insurance. There are a lot of great books out there about training your brain to be less anxious. I've talked about Dr. Joe Dispenza's Breaking the Habit of Being Yourself on this channel before. This is a wonderful evidence-based book that details actionable steps that you can take to train your brain to think less worrisome thoughts and replace them with more positive ones. I'll drop an affiliate link for it in the description. If you're a little bit crunchy and you want a more metaphysical read, then I highly recommend The Law of Attraction by Esther and Jerry Hicks. This book is a wild ride. I don't want to spoil it for you if you haven't read it, but if you can be open-minded, it can be really helpful. I read it last year and it definitely changed my life for the better. My biggest takeaway from this book is that when you start thinking thoughts that feel bad, for example, my intrusive thought this past month since I've been sick is, what if I cough so hard that I break my water? Which is definitely not a thing. Anyway, when you start thinking those thoughts that feel bad, just recognizing it and thinking, hey, this doesn't feel great. What can I think instead that will make me feel better? And it might sound stupid to someone who doesn't struggle with anxiety, but I found this book really gave me control back over my brain and my thoughts. Obviously, it's a work in progress, but I feel like this book has helped me come a really long way. Again, I'll drop an affiliate link in the description. Moving on to medications. I would like to preface by saying these are all my opinion. Your healthcare provider may have different life experiences that make them comfortable prescribing different medications. The only medication specifically for anxiety that I feel comfortable prescribing in pregnancy is hydroxyzine, and a lot of providers won't even prescribe that. It's not a super strong anxiety medication and it can make you feel sleepy, so I find if you're having thoughts that are keeping you up at night, it can be really helpful for that. We've mostly moved away from using the drug classes that we used to use to determine if a medication was safe in pregnancy or not, but hydroxyzine was pregnancy category C. This means that the medication did show some harm in animal studies, but there were inadequate human studies. That being said, the doses that caused harm in animal studies were much higher than the doses we give to humans, and they were much smaller animals like rats or rabbits. The reason I feel comfortable prescribing this medication in pregnancy is because it used to be handed out pretty readily for nausea and vomiting in the first trimester. So I have seen this medication used without negative side effects, but also if I have a patient who really needs medication for anxiety, this is one of the safest options that I have. I think it's worth noting that the other medications in this drug class are generally considered safe for pregnancy as well. There is some research available on hydroxyzine, including a meta-analysis of 10 studies which showed no increased risk of birth defects or negative pregnancy outcomes following hydroxyzine exposure. There was one case study published in 2005, so literally one case, where a mother was started on a high dose of hydroxyzine, 150 milligrams daily, at the end of pregnancy, and her baby experienced neonatal withdrawal syndrome. I usually start patients on a dose of 10 milligrams up to 4 times daily, and I don't usually prescribe more than 25 milligrams up to 4 times daily, so 40 to 100 milligrams daily, so less than this 150 milligrams dose, which is a lot of hydroxyzine. If this is an option that you want to consider, I would recommend talking to your healthcare provider about it. You will find a lot of websites, including the manufacturer's website, that say that hydroxyzine is not safe for use in pregnancy, but they're specifically citing the harm caused in those animal studies with the high doses of medication, as well as the overall lack of research in pregnancy, which is the case for most medications. I don't prescribe it a lot in pregnancy, but if I have a patient who really needs anxiety medication to get through their day, like they can't do their job without it, then I think it's a reasonable option. Another medication that can potentially be used for anxiety in pregnancy is Tradzodone. This is a medication that's specifically used for insomnia, and for a lot of patients with anxiety, that's the biggest problem that their anxiety causes. I know that's certainly the case for me. I struggle with intrusive thoughts, and when I lay down to go to bed at night, it's like my brain is just putting out feelers for something it can latch onto, and once it does, I just start to spiral, and no matter how exhausted I am, I cannot fall asleep. I will just stay up worrying for hours. Tradzodone will usually do the trick for me. When I'm not pregnant, I can take 100 milligrams, and typically I'll be asleep within 30 minutes. This is also a medication that is commonly prescribed for women struggling with opioid withdrawal, so in addition to methadone or Subutex, they will also be prescribed Tradzodone to help them sleep. We know Tradzodone crosses the placenta, and the available data hasn't shown any negative pregnancy outcomes, but because there's no long-term research on neurodevelopment, it's generally not recommended in pregnancy, with the exception of women struggling with opioid withdrawal, because in that scenario, the benefits are thought to outweigh the risks. I would certainly rather my patient take Tradzodone than fentanyl. Otherwise, it's not recommended to start Tradzodone for the first time in pregnancy. I have continued to take Tradzodone some this pregnancy after discussing it with my OBGYN, just because for me, sometimes the alternative is not sleeping at all. And that's just not an option for me when I'm in life or death situations at work and I have to write prescriptions and be able to function during my day. I have tried to limit my usage of it, and I'm going to work really hard to avoid it in the 3rd trimester, because since it makes me sleepy, it may also make my baby sleepy, and I worry that my baby might not breathe well at birth if I have Tradzodone in my system. The other medication that I use for anxiety when my brain just refuses to quit and I can't get to sleep with Tradzodone is Diazepam, which is also known as Valium, and it's absolutely contraindicated in pregnancy. There are studies showing harm to babies when this medication has been taken by pregnant mothers. This is the case for a lot of the stronger anxiety medications like Ativan, Xanax, and other benzodiazepines, and they should usually be stopped with a positive pregnancy test. I hope you found this video helpful. If you did, please give it a thumbs up. If you have other questions about managing anxiety in pregnancy, please drop them in the comments. I will make that video next week about depression and what depression medications you can continue to take in pregnancy. I post new videos every week about infertility, pregnancy, and motherhood after 35, so make sure you subscribe and turn on the notification bell so you don't miss an upload. Thank you so much for watching.